Hi everyone, welcome to another session wherein you can see on the screen by itself that today we are going to talk about a very important topic, which is your maternal mortality rate. Yes, you can just call it a report also, which will give you an entire insight that the maternal mortality rate hai, when we see it at a macro perspective. Here we will see what are the conditions of the countries in total. So global perspective पे जो report है, we will do a proper analysis of it. But before everything, it is important to know that what is basically our maternal mortality rate. So I'm very sure that it is known by everyone. So जितने भी maternal death होते हैं per 1 lakh of live births for a specific, during a specific period of time. Now that specific period is usually a year. Now this is all surrounded by it. But we have, few of the sustainable development goals also, which ensures कि जो maternal mortality rate है वो कम से कम होना चाहिए. If any of the country has, less maternal mortality rate, so that shows what? That particular country has a proper healthcare system, that government is, highly focusing on the healthcare system. So one by one, we'll see the performances of the rest of the countries also, and we'll see that which country is the one who has performed very well, and which, countries are the one who have performed very worst. And we'll also talk about the sustainable development goals here, particularly 3.1, which has a lot many things which are connected to it. So India के perspective से एक अलग report निकाली जाती है, but this is a particular report which is in organization of, you can consider that a lot of international organizations take a part here, which releases this particular report. So you can see in the news by itself that we have, many of the, you can consider. Okay, this is estimated by what? This is estimated by your WHO, your UNICEF, your UNFPA, World Bank Group, and UNDESA population division. So this is what it is estimated by. So when I talk about this, trend, that is, a complete estimate right from 2000 till 2023. इसके अंदर कितने estimates है, as in कि what does data says, where are the countries heading towards when they specifically focus on the maternal mortality rate. So ये सारी चीजें हम आज की वीडियो में analysis करेंगे. We'll do proper analysis of it. One by one we'll see it. So, heading towards it, you can say, you can see that a lot many people ask, a lot many students ask that, ma'am, जो PDF है वो कैसे download करना है? So, बच्चे, firstly, you have to download the Olive Board app, and then you have to register yourself. उसके बाद एक pop-up आएगा courses का, you have to click on it, and then there will be a pop-up of YouTube class PDFs. So इसके ऊपर जाके you can just download the PDFs of the YouTube classes. ठीक है? Now we can see the background by itself. So this is a situation of 2023. What does report says? So every day in 2023, over 700 of women died preventable causes related to pregnancy and childbirth, meaning that approximately one woman is dying every 2 minutes. This is what is said in the report by itself. So this is what is the data. But now we have few of the, you can say limitations also, कि हमारा ये जो particular goal है, हमें ये achieve करना है, जो maternal mortality rate है, वो कम से कम होना चाहिए. But what is that? What is that limit? So we have sustainable development goals. We all know we have sustainable development goals, which consist of 17 goals as well as 179 targets. Yes, 169 targets. So that is what it is. But now we have one of the goals, we have one of the targets which is specifically related to what? Which is specifically related to your maternal mortality rate also. That it should be less than 70. It should be less than 70. So you can see the situation by itself that the target, we have a target to reduce it less than 70 maternal deaths per 1 lakh live births by 2030. ठीक है, by 2030 यही टारगेट है. हमें 2030 तक अपने जो सस्टेनेबल डेवलपमेंट गोल्स है उनको अचीव करना है. So this is one of them. Now we'll see which are the countries who are able, who are near to achieve it, and which are the countries who are performing very worst. So now you can see I've already told you the organizations which are here. ठीक है, जो organizations है that I've already told you. The next is that the estimates represent the most up-to-date internationally comparable MMEIG estimates of maternal mortality using the refined input data and your methods from the previous round. Now this is everything which I've already told you. Organizations मैं आपको बता चुकी हूँ कि organizations क्या है. जो ये particular report है India के perspective से अलग report आती है, but this is a report which is at a global perspective, as in the performance of the different countries will be evaluated here. कि कौन सी country अच्छा perform कर रही है particularly maternal mortality rate में, and which is the country which is performing worst. Now why is it news? What is the news here? So you can see that this particular report says that it has revealed that India recorded 19,000 maternal deaths in 2023, ranking it second globally, tied with the Democratic Republic of Congo and only behind Nigeria. Now you can see the situation itself, that where is India lacking. Okay, I've already told you that it is published by these many the international organizations which are there. Take it one by one, we'll analyze it. Now what is the purpose? What is the purpose? So basically I've told you the purpose itself कि जो maternal mortality rate है उसका हमें analysis करना है कि कौन सी country जो है वो अच्छा performance कर रही है और कौन सी country जो है वो worst perform कर रही है. Now why do we need to evaluate it? Because that will tell us कि which country is highly focused towards the health activities that are there. अगर कोई कंट्री हेल्थ में ऑफ कोर्स अच्छा कंट्रीब्यूट कर रही है, अच्छा इंफ्रास्ट्रक्चर डेवलप कर रही है, दैट इज द रीजन ओनली द मैटरनल मोर्टेलिटी रेट इज लेस इन दैट पर्टिकुलर कंट्री. So at a global perspective, they just want to evaluate that what is the performance of different countries and how government is taking it. Now we have done the objective. Now it will monitor the progress कि हमारा जो एक गोल है दैट इज सस्टेनेबल डेवलपमेंट गोल 3.1 कि 70 से नीचे होना चाहिए पर 1 lakh birth by your 2030. Are we able to achieve it or not? Are countries able to achieve it or not? Are countries going towards to achieve that particular goal or not? Next, it will identify the gaps. If there is any of the country which is performing well, and if there is any of the country which is performing worse. So of course a comparison will be made, and they will also see that what is the gap, where I am lacking behind. So they'll also get to know the gap areas. ठीक है, so ये सारी चीजों भी पता लगेंगे. Firstly, then a comparison would be made, evaluation would be properly done. Next, you have support to the policy makers also. So if we saw the situation of India, now accordingly government will see that where we are lacking behind. The initiatives which we have taken, are they working? Are they really, like, we think that they are working, but are they really working or not? These are the many situations that you will see here. Now what are the key highlights here? So globally जो decline है maternal mortality rate में, that is by 40% between 2000 and 2023. Now this is the case here, that there is a decline here, but still the the international organizations are saying though there is a decline, but still the situation is not just clear. Still we are at a problematic situation. We'll discuss in the coming slides. Now it is estimated that 2,60,000 maternal deaths occurred in 2023, about 1 every 2 minutes. Now specifically talking about this particular ratio, so ये कितना reduce हुई है, right from 328 to 196 per 1 lakh live births in 2023. This is what has been discussed here. Excuse me. Now this is what it is. Now we have seen कि कितना गिरा है, that is 40%. This is by 40%. But we have just told you, we have just discussed about the sustainable development goals also. Now the sustainable development goal says कि हमें कितना achieve करना है, it should be less than 70 per 1 lakh your live births by 2030. Now here is a doubt in everyone's mind that despite there is a decline, we know that the your mortality rate has been declined, but the pace is not as fast as enough that is required. The pace through which it is going on, that is not more than what is required, because if we want to achieve the goal, only 5 years are left. तो इसका जो पेस है, इसका जो स्पीड है, वो और ज़्यादा होना चाहिए. ये नहीं कि अगर कम हुआ है so we should become very happy. The pace is very low and it will become hard for us to achieve the target by 2030. This is what has been a concern which has been raised here. So this is specifically said that to meet the 2030 goal, an annual reduction rate which is your 14.8% is required, and only ARR is what? It is only 1.6%. So you see the gap. What is required? It is 14.8%, and where we are, what is the ARR now? That is just 1.6%. So there is a huge gap here. So that is the reason your international organizations are saying that though there is a reduction, but you need not to become very happy, because your ARR is very much less, and we will not, with this speed only, will not be able to achieve the target by 2030. This is the concern that has been raised. Now we'll talk about the regional disparities. So you can see that sub-Saharan Africa remains the hardest hit, your hit region. It contributes 70% of global maternal deaths, has an MMR of 54 per 1 lakh live births. Now, it is also said that lifetime risk of maternal death for 15-year-old girl is 1 in 55. Okay. Now, in contrast, when I talk about Australia and New Zealand, they have the lowest MMR, which is 3%, 1 lakh live birth. So this is what has been discussed here. Now, countries with the highest mortality rate, your maternal mortality rate. So we have Nigeria, which is 75,000 deaths. Okay. 28.7% globally. Now, India की situation तो हमने पहले ही देख ली थी. News में क्यों था? Because the maternal mortality rate is just has given us a shocking number. We are at 19,000. That puts a question on the infrastructure that government is putting on health. So this is what it is said here. So we are in the worst list. So second is your India and DR Congo, and Pakistan is at what? 11,000 deaths. So you can just compare the situation. Where we are lacking behind when we are continuously moving towards infrastructure, where we are lacking behind when we have such yojanas which is providing benefits to the middle class people also. So where we are lacking behind, this is a question in everyone in the government's mind. Now, these are the 4 countries which account nearly 47% of all maternal death worldwide. Now, talking about China, despite its population size reportedly significantly fewer maternal deaths, that is just 1,400 in 2023. Now, we are talking about the India specific data, so you can see कि record कितना करा है. We have recorded 19,000 maternal deaths right in 2023, equating to 52 per day. That is 52 per day. Now, it is also said that we have a drop here. So you can see that MMR dropped right from 362 in 2000 to 80 in 2023. There is a 78% of reduction. There is a 78% of reduction because the time has been so changed. When I compare with the policies and programs and, even the budget allocation towards the health specifically, the 2000 time was not very good. But since we are putting a lot of efforts towards the betterment of the health also, today is the time where we can see that at least comparably there we are at a better position. So of course there is a reduction, but still the situation is just worse. Now you can see that India shares the second position globally in the DRC, which is your 19,000 deaths each year. Nigeria has topped the list, which is 75,000 deaths, contributing to say 28.7 of the global total. Now a comparison has been made, so you can see कि यहाँ पे हमारा क्या है, second position है. But now comparing it with the Nigeria country, where they are actually in a problem. But how we can compare it with India? Nigeria is a separate you can consider it it's a separate region. But when I talk about India, so we are rich in everything. We are continuously towards the upliftment of the agriculture also. We are continuously towards the upliftment of infrastructure also. So we have put a lot many yojanas here. Government comes up with lot many schemes also. Due to the urbanization also, people are just aware of everything. We see of the India's report also that we are at a better situation. But what happened to us at a global perspective? So we are at a 19,000 death that specifically was there in 2023. Now, this is what has been discussed here. कि जो हमारा state है, we are having achieved the Sustainable Development Goal target of MMR below what? Your 70 lakh live birth by 2030. So this is what has been discussed in the maternal mortality ratio. Right when I talk about the India's, your India's, you can say, schemes that are there. For example, you have Poshan 2.0. So this is a specific picture which has been taken from Poshan 2.0. So when we talk about the India's perspective, we consider that it has, we have brought a lot of improvement in our maternal mortality ratio. We are at a better pace. Now, when I compare it with the past time, we were not at a better pace, but now we have come up with a lot many, you can say, schemes and, health, you can say, benefits to the specifically your maternal women. For example, you have Poshan 2.0. For example, you have Mission Shakti. So these are the many schemes, these are the many initiatives which are continuously towards, reducing this particular problem, which is your maternal mortality ratio. Now, these are the many, you can consider countries which are, your states which are considered here. Now, what are the contributing factors in India? So, medical causes are there, health system gap is there, socio-economic challenges are also there, chronic conditions are there, and regional disparities also there. Regional disparity as in that northern India faces higher mortality due to the limited access to healthcare as well as greater poverty. So, these are the many, things which I've specifically mentioned in the report. But Now again, the question is that when we talk about the India's regional reports, they say that we are at a better pace. Now when I talk about the macro perspective, when we are taking each and every country, we are just at a worse position. We are just behind what? We are just behind a country like Nigeria. So this is what has been mentioned here. Now we'll talk about the conflict in fragile settings. So you can see that 61.4% of the maternal death occurred in fragile and conflict affected countries. Okay, in the conflict affected countries. Now conflict affected countries, you can consider the countries where continuous fight is going on. So we have to analyze their situation also, that we have seen that we are at a worse position. But what is the position of the rest of the countries also? So now you can see that MMR in these settings is 504 per 1 lakh. Lifetime risk of maternal death in conflict is just 1 in 51. Success stories में you can see that countries showing notable declines in MMR between 2000 से लेके 2023 तक. So this is Belarus, a reduction by your 94.6% is there. Bhutan is there. Kazakhstan is also there. Now no country has reported a MMR above 1000 in 2023. This is historically for the first time that we are at a better position. Of course, each and every country is just focusing on the upliftment of the infrastructure, and we are also contributing towards what? We are also contributing towards the betterment of the healthcare of the people, because they are the asset of the country. So this is what has been discussed here. Now what are the setbacks as well as slowdowns? So post your 2016 progress has been slowed. Now Latin America as well as your Caribbean, where MMR was actually increased. And when I talk about even your COVID-19, after effects of the COVID-19, so it caused a spike in the maternal mortality death in 2021, but levels have been declined when I compare it with the 2023. So these are the after effects of your COVID-19 also. But now is the time that we have seen a reduction here. Now what are the leading causes? So one, we have direct causes, another one we have indirect causes. So direct causes includes what? So you can see your your postpartum is there. Similarly, you have hypertensive disorders, your sepsis, your unsafe abortions. These are the direct causes of the maternal your mortality rate. When I talk about the indirect causes as in which are not through the direct contact. So you have tensions, you have hypertensions, you have infections, any of the infections. Similarly, you have non-communicable diseases also. They also play a very these are also a major factor which are continuously contributing towards what? Towards the your maternal mortality deaths that are there. Okay. Now we'll talk about structural barriers. ठीक है, जो maternal mortality है, इसमें जो structural barriers है वो कौन कौन से आ रहे हैं? So you can see that gender inequality is the one. ठीक है, each and every gender is not considered equally. ठीक है, if man is working somewhere and women is working somewhere, of course they are not given equivalent pay. That is one of the things that we have. Gender inequality is there. Similarly, we have lack of access in the quality health care. Now each and every country should have this an obligation that out of their budget they should contribute highly towards the healthcare services, so that people should get benefits. People should be at a better position. We have today we see that the diseases which we've not even heard of, they are affecting people. So with that, with the increase of the diseases, with the increase in the pandemics, and with the increase in the uncertainties, it is also the responsibility of the government to increase the budget so that it can meet the uncertainties that are there in the particularly your healthcare sector. Poverty as well as weak health systems also. Poverty and weak health systems also. Now you people tell me that what is the one step which has been taken by the government of India to provide generic medicines at an affordable price. Jan Aushadhi Kendras are the one. So India has catered, I would say, largely to each and every area where they think that people need the people are in need of the government. So when I talk about the affordable medicines, people is government is there also. Now when I talk about your providing your healthcare benefits, government is there also. Similarly, maternal mortality rate, maybe we have Poshan, we have schemes like Poshan 2.0, we have schemes like Mission Shakti. So these are the many schemes which are associated with it. So now you have storage of shortage of trained health workers is there, and adequate data system is also the case where we are lacking in. Now what are the recommendations and call to action? So similarly, one, prior to everything, budget. Allocate the budget to your healthcare system so that we can see improvement tomorrow. We can see improvement tomorrow. This is one and foremost step which each and every country should do. Next is the primary healthcare system. Primary healthcare जो system है उसके ऊपर focus करना शुरू करो, and then you see the rest of the things. Similarly, we are in need to make healthcare sector really very affordable so that each and every section of society can afford it. Now I just told you that India has Jan Aushadhi Kendra. So now that is for what? That is for the people, specifically catering your, have-nots. Because have-nots are the categories. Have-not is this, particular category which is not able to afford the, your, you can say, mehengi medicines at what? At a, that too of a better quality. So now even if they want to, purchase those many medicines, and they also want this thing that the quality should remain equivalent. So Jan Aushadhi Kendras are the one which is specifically solving this particular issue. Now we also need to increase investment. So I've already told you sexual and your reproductive health services should be better. Health workforce training की तरफ ध्यान देना है. Data collection and monitoring के ऊपर भी we need to focus on, and we also urge a renewed political and financial commitment to reach the sustainable development goal 3.1, because otherwise this will be very very tough for all of us to reach there. As when I talk about your ARR, okay, your annual reduction rate is just very low. The gap here is so much. So now we'll talk about the government measures to adopt or to address the maternal mortality rate. So you have Janani Suraksha Yojana. This is specifically your India's. Okay, Janani Suraksha Yojana is there. Similarly, you have Pradhan Mantri Surakshit, your Matritva Abhiyan, that is another one. Lakshya initiative is there, which is important. Poshan Abhiyan is there, जिसमें Poshan 2.0 भी चल पड़ा है, ठीक है. We have seen its extension also, Poshan 2.0. Strengthening your FRUs and your referral services also there, and midwifery led care. These are the many initiatives which has been taken by the government of India. Now the question is that although we government is allocating budget in the bringing more of the schemes for the betterment of the maternal mothers, lactating mothers, the people, the mothers who are pregnant. So these are the many schemes which have been taken by the government of India just to make the situation better. But still we are at at a global perspective, we are somewhere or another at a worst countries in the list of worst countries. So now government needs to I would say the government needs to revisit each and everything that is there, and it has to see that where they are lacking behind and why they have come here, why they have come this why they have come at this particular position. Now before everything, we'll just go to the questions, because this is a particular report which is very important. So which of the following statements is true according to the UN's 2023 report on mental health mortality? So this is we read here that Nigeria accounted for over 1/4 of the global maternal deaths. That is the case. Okay, that is the truth. So yes, the correct answer is C only. Okay. Now next question is, what was the estimated global maternal mortality rate in 2023 according to the your WHO report? So we all saw that 197 per life 1,000 per your 1 lakh live births is there. So C is the correct answer. Similarly, which country recorded the highest number of maternal mortality death in 2023? Highest number of. So Nigeria is the one. And second कौन आया था? Your India as well as your Democratic, your Republic of Congo. So these are the second states. Okay. Now we are coming on to the third, your fourth question, which says, what is the minimum annual reduction rate required from 2024 to 2030 to meet the Sustainable Development Goal target? Annual reduction rate आपको बताना है. So the correct answer we have is 14.8. Okay, 14.8. 14.8%. बहुत ज़्यादा चाहिए, but हम किस पे हैं? हम जो है सिर्फ हमारा जो annual reduction rate है, that is 1 point something only. So this is what has been discussed in this particular report. You people, and this will highly help the government of India also to just analyze the situation that all, although we are coming up with a lot many initiatives, but somewhere or another we are lacking behind. That is the reason we are at a second worst country. We are at a second worst nation. So now government needs to evaluate the situation, and accordingly the steps will be taken tomorrow. And we can expect also that tomorrow we can see more of the budget allocation in the healthcare sector, and more of the schemes can also be seen in this particular, health, specifically your catering this particular, problem, which is your maternal mortality, your rate. And we also have to ensure that we are reducing it, we are bringing it to the limit according to the Sustainable Development Goal 3.1. So this is what has been discussed here in this particular report. I hope each and everything is clear to each and every person. If you people have any doubt, you can ask me in the comment section. Of course, I'll give reply to it. So all right, take care. I'll see you in the next one. Bye-bye.